And you're live.
Hi. Should I wait a moment so that more people can log on?
Sure. So then we can get started.
Okay. Hi everyone, it's Elizabeth at Dr. Emer's, and for those of you that have been following our amazing patient Gordon, you'll know that he received a very aggressive Fraxel. Gordon has been through this process before, so he knows what to expect. When you are going through Fraxel downtime, it is normal for your skin to be red, swollen, peeling, and if you can see, like right around his mouth, there is some bleeding and a little bit of oozing. All of this is totally normal. I never want anyone to freak out when they're going through a Fraxel, erbium, CO2, any type of aggressive ablative and non-ablative laser that we do. Our post-procedure oxygen treatment is a standard process of the healing process because it helps with the downtime, it helps the skin to heal a lot faster. So I highly recommend for everyone to book their healing oxygen facial about 3 days out, and then you can you could do another one a week after. So what we're gonna start with is going to be our Restorsea Pro-foaming cleanser. And this might tingle a little bit because it uses our salmon roe enzyme. And I'm going to apply this on his skin because I want to get rid of as much dead skin as possible, but I don't want it to cause any major irritation. So I'm just going to apply a little bit at a time. I'm going to really work it in with my fan brush, and then I'm going to work it in with my hands. So the post-procedure oxygen facial, we use the Restorsea Pro-foaming cleanser, and this is the cleanser that Gordon should also be using at home. So we're using this to help get rid of any dead skin and to also gently exfoliate.
Why should you not peel off the dead skin?
That's a great question. If the skin hasn't fallen off, that means that the skin underneath it is not fully ready, and you could put your skin at risk of post-inflammatory hyperpigmentation as well as scarring. So we definitely don't ever want you to pick at your skin. So let the gentle enzymes do that for you. That's also why we recommend Cleanzyme and Skinzyme.
Can you get PRP after laser to help with healing?
Absolutely, that helps tremendously. PRP will help regenerate your skin. It's very healing and soothing. We recommend it to everyone. So we're just gently cleansing the skin, but our Restorsea Pro-foaming cleanser is also helping to get rid of dead skin. Look, you can see the dead skin on my glove. Oh, I love it. Okay, so you want the dead skin to gently come off. You never want to add a lot of pressure because his skin has already gone through some serious trauma. So if I were to be aggressive, that could cause more post-inflammatory hyperpigmentation, and that's not what we want. We want to be very gentle and let the enzymes work for us. So I'm going to do one full pass and just really work it in there. And you can see right around here, he has a buildup of dead skin. So we just want to make sure that we work that area a little bit, but I'm not applying any pressure. I want to be very, very gentle with Gordon's skin. So once we've cleansed it, I'm going to go ahead and gently wipe off as much as possible without, you never want to be too aggressive. So also for all of our patients that are going through this healing process right now, be very gentle with yourself, be gentle with your skin. You're going through a healing process. See the dead skin on there? So cool. So you're going through a healing process. You don't want to be super aggressive on your skin. That's not the objective. You always want to be gentle and take your time. It's going to take a while for your skin to heal. It's normal. So the oxygen treatment really does help to calm and soothe the skin. Oxygen helps to regenerate your skin faster. So we're helping your skin heal and we're pushing it along so that it heals faster. How does it feel, Gordon, right around your mouth area?
It feels refreshing.
Yay, good. We never want it to be something where it like hurts or it's bothersome. We always want it to be gentle and refreshing. Okay, so as you can see, dead skin is still falling off, but I'm not like rubbing it off. I'm just kind of like pushing it along. And I'm going to do one more pass with our Restorsea Pro-foaming cleanser. So the reason why I use this cleanser specifically is because the cleanser has salmon roe, hydrolyzed roe, and the hydrolyzed roe helps to gently eat away at the dead skin, and that's why I like it. So we always use this for our post-procedure treatment. And you could do as many of these as possible. We have some patients that come in and they do 4 or 5 just to help their skin heal faster.
What are other like normal downtime signs?
Say that again?
What are other signs that are normal when it comes to downtime, like itchiness or?
Absolutely. Your skin could be itchy, your eyes even, like areas that Dr. Emer didn't treat, like if you didn't get too close to the eye area, that could be swollen, oozing of the skin. You might feel like very, very sensitive in certain areas. It's normal. All of it is normal, guys. I never want you to freak out. We are causing controlled damage to the skin so that your skin is able to then create more collagen and elastin.
And for how many days after the treatment can you not shave?
Not shave?
Yes.
After a laser?
Yes.
That's a good question. I would say until your skin is fully healed. You don't want to cause any over-exfoliation. So I would say about 2 weeks, maybe 7 to 10 days. I mean, if you absolutely have to, then just make sure that you're very gentle. But I would say wait about 7 to 10 days. Gordon, you haven't shaved, right? No?
No.
He hasn't shaved. All right, so this is my second pass with the Restorsea Pro-foaming cleanser. And you can see that more skin is coming off.
Would you still use SPF?
100%. You have to use SPF, guys. You have to.
What laser treatment did he get?
Gordon received a very, very intense Fraxel. Very high setting.
And erbium.
And erbium.
And microneedling and Fraxel.
Okay, so Gordon got the works. That's why his skin is healing like this, and that's why his skin looks so red and sensitive and irritated. And this is all part of the process. And you can see some oozing there. All of this is normal. All right. So the next step is the oxygen infusion. So I like to combine oxygen with vitamins and minerals to help the skin heal a lot faster. It's going to feel very cooling and soothing and refreshing. And oxygen is helping the skin heal faster. The vitamins and minerals are making sure that the skin has everything that it needs to be able to heal properly. So Gordon, this is going to feel very soothing. Ready? So this just feels very hydrating, calming to the skin.
Smells good too.
Yeah, it does.
And it smells good. Does it smell good too? Good. I put a lot of vitamins and minerals in there. I also put some arnica extract to help with the inflammation.
Can you repeat what this is called?
Yes, so this is the oxygen therapy. We use oxygen, pure oxygen, to help the skin heal, but we also combine it with vitamins and minerals to make sure that as the skin is healing, it has everything that it needs to heal properly. This is one of my favorite treatments to do because the patients really do notice an improvement after, and their skin feels a lot more hydrated as they're going through the healing process.
Can someone with melasma undergo this treatment?
The treatment that Gordon received?
Yeah, I guess the laser.
You could, but we would need to see your phototype and you would need to prep depending. Typically, our patients with melasma need to prep with Cosmelon 2 weeks before they do any type of aggressive treatment with Dr. Emer.
And how does this feel?
How does this feel, Gordon?
It feels, as she said, it feels really good because my skin was dry and tight before I came in here, so it feels good.
Good. I told you. So this treatment is awesome for anyone that has gotten an aggressive laser done with Dr. Emer, or even a not so aggressive, a non-ablative, if they've gotten Fractura done with Danielle. Our oxygen treatments really do help to get the skin healed as fast as possible. And they also help the patients feel better because going through this type of downtime is not easy, right, Gordon?
No.
It's a little bit challenging, and we want to make sure that your skin feels nice and hydrated and that it heals as soon as possible. So oxygen facials are amazing. I like to refer to them as post-procedure facials or post-procedure treatments. A lot of the time we focus our attention on the main treatment, but it's very important to also direct our attention to what patients are going to need after the big laser, after the big surgery.
Is this oxygen or water with hyaluronic acid?
This is oxygen, hyaluronic acid, and vitamins.
Feels very good.
It's like my own little blend. I feel like a chemist. If I showed you guys all of the vitamins and amino acids that I have, actually I will. I'm going to show you guys. So we're able to fully customize our infusion for every single patient. So the vitamins and minerals all going into Gordon's skin.
If you haven't gotten a laser treatment, can you still get this?
Yes, absolutely. This helps before any major event. So what I like to do sometimes is combine dermaplaning and oxygen facials because your skin is going to glow when you apply makeup on. So if anyone has like a red carpet event, this will look amazing. It also helps with patients that have rosacea. So with patients that have rosacea, I like to use a chamomile combination when I'm doing the oxygen facial. So like I said, this is fully customized for everyone's skincare needs, and it's also good for people that have cystic acne because oxygen helps to reduce inflammation. All right. How is your skin feeling,
It
Gordon?
feels so good.
Good. We're gonna do
Can
a
I
little...
take the machine home with me?
No. You have to come back and see me. Now I'm just doing pure oxygen now that I've delivered the vitamins. And then immediately after I do the oxygen infusion, we move into my favorite mask, the post-procedure crystal fiber mask. I'm obsessed. It's highly saturated in platinum powders, so it helps to reduce inflammation, and it also has high concentrations of hyaluronic acid. So it's ideal for anyone post-procedure, post-laser, post-filler even, post-Botox. It helps with inflammation a lot. So we're going to apply it on Gordon under LED. All right.
How often would you recommend this?
The oxygen facial post-procedure, I would say every 3 days, and you can do as many as 4 or 5. It just helps to speed the healing process. All right, so let me grab my crystal fiber mask. And, excuse me, let me get it out of my little cooler. I have a cooler now, guys. Let me show you. So I keep the masks cool in here. So these are the crystal fiber masks, and I'm going to apply 2 of them. Gordon's going to need one on his neck because Dr. Emer treated his neck and his face. So we want to make sure that we treat both areas, and then we're going to put Gordon under LED. LED is also going to help with the inflammation. It's going to help push the platinum powders deeper into the skin, and it's going to reduce any redness or swelling. So the crystal fiber masks come saturated in platinum powders. Let's see, ready, Gordon? It's gonna feel really cold. Does it feel good?
Mm-hmm.
Okay. He took a deep breath. That's a good sign, guys. All right, so I like to do these post-procedure. So these are actually called post-peel because they're fantastic post-peels as well. So for anyone that's going through the healing process with Cosmelon, the post-peel crystal fiber masks are also great for that. And they are ideal post-laser. How is it feeling, Gordon?
Feels so good.
Good. That's the other reason why I like post-procedure facials, because I feel like all of our patients are like, oh gosh, another treatment, I don't know what I'm in for. And the oxygen facial is so nice and relaxing and soothing, so that's a good thing too. We want a combination of both. All right, so we're gonna go ahead and apply this on Gordon's neck. There we go. All right, and we're gonna leave this on for a couple of minutes. I just wanna show you guys. Gordon, is that feeling okay?
Mm-hmm.
I wanna make sure that I get every area that Dr. Emer treated. Okay. All right, so we're gonna go ahead and put goggles on Gordon, and then we're going to plug in the LED light. And then, if we could turn off the lights, please. Can we still see?
Yep.
Mm-hmm.
So what are the different light settings and which one are you picking from?
So I'm using the pain light, and I want to use this because the red light is what really helps to reduce inflammation in the skin. Gordon, is that comfortable for you?
Mm-hmm.
Okay, so the red LED light is going to help with inflammation. It's going to help with any redness, swelling, and it's also going to help calm the skin down. So any inflammation that Gordon has going on, any redness and swelling, this is going to help suppress that and minimize that. So what I'm going to do is I'm going to leave this on Gordon's skin for 10 minutes, and then I'm going to remove it, and I want you guys to see how different the skin looks post-oxygen treatment. So thanks for tuning in. I'll be right back.